Well, my name is Elizabeth Serva, and I've been a family doctor for 20 years. I know babyface can fool them, but I've been around. And I think it's very important that everyone feels comfortable with their family doctor. The latest term is primary care physician or primary care provider. That's sort of the latest politically correct term that we're using nowadays. That includes family doctors like myself that are sort of like the buffet we had at lunch. I do soup to nuts. Another type of primary care provider would be a general internist. They don't see children, at least under 18. They're not comfortable. Their training is more geared to adult medicine. So they have the same classes that I do in cardiology, GI, pulmonary, but they tend to stick with people of a certain age. Another primary care provider, if you have children, could be a pediatrician. And pediatricians just see children up to the age of 18. Some of them will see up to 21, depends on the pediatrician. But I know I kind of got a little uncomfortable at 16 sitting on the little baby chairs in my pediatrician's office. So I knew it was time to move to a family doctor at that time. And for some women, they can pick a gynecologist as their primary care provider. And a lot of our gynecologists today do more than just the female gynecology. They will take care of other things, but that is at his or her own discretion. A primary care doctor is to try to keep you healthy if you don't have medical problems, and if you do have medical problems, to try to control and get you to the best care and best specialist possible. So between the ages of 20 and 40, I recommend a general checkup every 2 to 3 years if you have no medical problems, because you don't know if your blood pressure is high. You don't know what your cholesterol is unless you get it checked. You don't know if you're diabetic unless you have pretty overt signs of thirst, hunger. I always joke and say I want the weight loss without trying, but that wouldn't necessarily be a good thing. We can be the gatekeeper. When HMOs first came out about 15 years ago, I hated that word. I hated to say that, oh, you have to go through me to go to someone else. But I like to describe it more that I have the education and I can help you decide, is it a cardiologist that you need, or is it a pulmonary doctor? Is it a lung problem rather than a heart problem? So that you're not wasting your precious time and you're not wasting another doctor's time. That's what I'm here for. I'm here to help you understand your problems and get you to the best care. I read an article about some traits that patients thought make a very good family doctor. You want someone who's confident, but not overly confident. You want someone who can understand you. I've been through the deaths of my parents, my grandparents. My brother has had cancer. So when I see my patients, I tell them about how bad smoking can be, because I lost my father at 67. I tell them about the struggle my mother had with ovarian cancer and how it shortened her life. Another trait is being human. I guess that kind of goes along with being empathetic. Just because I wear a white coat doesn't mean I'm any different than anyone else in this room. We all were born and raised the same way. I just happened to get a degree. I was 12 years old when I came home and told my parents I wanted to be a doctor. I don't know what possessed me at that age. I did have an experience, though, that I'd like to share with you. We were a 3-generation house. My grandparents, my parents, and I all lived together. and my grandmother was dying. Wasn't sure exactly what she was dying from. I was only 12. But back then, doctors would make house calls. And my brother and I were in the living room, and the doctor came down the steps and said to my father, "Steve, I'm surprised your mother's still alive. That'll be $5. And here is a man about to lose his mother, tears welling in his eye, and 2 children in earshot. And at 12, I thought, damn, I could do a better job than that bozo who calls himself a doctor. And I said, if God gives me the courage and the strength to make it through medical school, I was always going to remember that living room. So as difficult as it is to tell a family or to tell a person that unfortunately they have something terminal, I remember how it felt to be a family member. And I pride myself on being that person, trying to be in that person's shoes, and to be respectful. That's another trait that patients think is important. Another key trait they mention is being thorough. And I know a lot of my patients, doc, I don't want to go for my colonoscopy. Oh, doc, I don't want to have my pap smear or my mammogram. But they're important parts of health maintenance. It really is, the saying is true, an ounce of prevention is worth a pound of cure. So we're not looking to find things. We didn't cause the diabetes or that polyp in your colon. It's there, but if we find it early enough, we can take care of it. Some things to ask if you're searching for a new doctor is, are you comfortable seeing a woman? Unfortunately, for the males out there, I believe the ratio is about 60% female in medical school today. When I was in school, it was about 30%. And it seems that the majority of female doctors go into primary care specialties: family practice, internal medicine, OBGYN, and pediatrics. It seems the guys are the ones who like to play, with the tools and the surgery and the orthopedics. So another question is age. You may not want someone who's about to retire, because you get to know them and then, bye, I'm off to Florida. We have a mix. We have some not so young people. I still think of myself as young, but I do have the seasoning of 20 years behind my name. And we have people that have just completed their residency. And I think it's wonderful that they have paired someone like myself with a younger doctor so that I can learn from him and her the latest techniques, what's new, and they can learn from my experience, that gut feeling that you just get by doing this. It's the practice of medicine. It's not a true science. Another concern is office hours. You may find someone that you love, that you want to follow. If they're only open 9 to 3 and you work 9 to 5, then that's going to be a hardship, because you're either going to have to take a day off. And I know on my days off, I'd rather be down at the beach than sitting in a doctor's office waiting to be seen. Communication. You want someone who you feel comfortable talking with, because when that door's closed and you're with your doctor, you should be able to tell him or her anything. And if you don't have that trust, it makes it hard to be able to come truthful and say, my son just got arrested, or I think my husband is having an affair. Those are things, the medicine is in the books. I could always look that up. But if your sugars are out of control and you tell me you're watching your diet, well, could it be because there's some stress in your life that we need to find out about, and we need to direct you to how to reduce that stress? We all have family members that you wish we could bop upside the head, but there are family members. We can't do anything about them but love them. Location. Are the locations ideal for you? If you spend most of your time working, maybe finding an office near work is better than finding an office near home. Insurance is also a big factor. You might find a doctor who may not take your insurance anymore. So talking to your insurance company and finding who's still open in the community is one of the first steps if you are planning on trying a different doctor. And of course, personality. I think that goes with the traits that I talked about earlier. And don't be embarrassed to ask any question of your doctor. The only stupid question is the one that's not asked. The one that you leave the room and think, oh, I wish I would have asked him or her about.